Of course, I can't tell you all exactly what's going on in my mind because of confidentiality, but the occasion has arisen once again for me to think about some of the deeper ethical problems of working in a job like mine as an addiction counselor. And I don't want to seem like a soulless robotic person who has no feeling, but I have to, because of confidentiality, remove a lot of the feeling aspect from it if I'm going to discuss it at all with anyone or have any outlet at all. That's the problem with having a job like mine. But on occasion, if you work in certain fields, your clients are going to die. Your patients are going to pass on, and it will be because of the thing that you work with them on. And there are many different professions that have this happen. I imagine oncology must be horrible and dreadful for that. You know, doctors must really get to polish their speeches to the families of "I'm sorry, but," you know. But in my profession, sometimes you don't get such clean closure. For example, sometimes if one of your clients passes away, you don't get to know right away, because why would you? They just don't show up for their regularly scheduled visit, or their routine is off, and you don't see them for a while, and then you think, well, damn, where is this person? Maybe you ask one of your other clients, you know, or one of your other clients says they haven't seen that person around. Or you could find out in other ways. For example, if you were part of a medical provider that had HIPAA-like transfers of medical information back and forth, you would see things such as maybe a visit to the hospital that was dire, or every time someone dies, the coroner asks local hospitals, you know, hey, you ever deal with this client? And then each hospital writes a little clinical summary and, you know, puts it together. And if you saw a bunch of them on the same day, you might rightfully assume, hey, something very dreadful happened that day, such that multiple different hospital networks had to make a clinical summary of all the care that they've ever done for that person. So then you just, you know, infer it was dire, you know, either near death or death. But sometimes you just never get to know. You know, if your clients are John Does in the system, you know, because of the way that they died, because they were indigent and they end up getting put in a potter's field somewhere, you just might never get the closure of being able to know exactly what happened to them, you know. In the course of today, I've been thinking about autonomy and how some people prize it as something to strive for, that clients make their own decisions, you know, and more I realize that addiction is something that robs someone of their ability to make decisions. And so when your ethics have certain principles, and one of those pillars is autonomy, respect the autonomy of the person, and you're dealing with addiction, sometimes the gross, horribly distorted conclusion that you come to is that some professionals merely are there to witness the death of a person very slowly. And it's because they have taken these principles and they take them to these illogical extremes of respecting people's autonomy and never trying to interfere in their lives, just giving them advice here and there. And sometimes I'm like, we're not dealing with a level playing field here. This is not a normal mind. These are chemical pathways that have been altered in the brain, which make it so that this person cannot decide for themselves. And sometimes you do have to intervene a bit. If you're brave enough, maybe you will get there to that point where you actually do start giving a damn and stop making excuses for why there's a horrible success rate in your field, and using platitudes that make you okay with how people are dying left and right, and we still haven't found much evidence-based therapy to be able to fix them, In the end, my perspective may save maybe 1 out of 5 of my clients, because drugs fucking work, right? But at least I'm trying, and batting 200 is a lot better than batting 0 because you never tried. And yeah, I'm not angry at those that have passed away because they were addicted as much as I am upset with systematic failures and the perspectives of my coworkers. And that's where I'm going to leave that today.